Hi, this is Don Pelto. Today I want to go over using patient presentations to increase efficiency and profitability in your practice. This is the same presentation that I gave at the recent Superbones conference in 2020. So let's look a little bit into it here. The description and learning objectives, we're going to go over how to use PowerPoint presentations in your patient encounter to improve care, to reduce complexity, and increase your bottom line. We're going to learn about the importance of using protocols and checklists in podiatric medicine, learn how to make your own patient presentations to use during your patient encounter, and learn how to incorporate PowerPoints during your patient encounter easily and effectively. I don't have any disclosures for this talk, but I want to start by talking about the problem. The problem is that today there's an ever increasing amount of treatments that we can use for a lot of conditions. And as specialists, those that come to conferences and learn new techniques, we can, for some common problems that we've learned about here, such as fungal toenails, plantar fasciitis, hammer toes, and the like, we can have a lot of explanations. And a lot of times these are complex. They may not be complex for us, but when we're trying to communicate them to the patient who's heard it only the first time, it can be very complex. And also there's too many treatment options. The options keep on multiplying. And what options do you talk about? When I first started to be in practice, I tried to talk to patients about everything. And then you tend to waste time and spend time not talking about what's really that important. And that combined with having limited time with patients. Many times we're rushed, we're in a hurry. And then finally, the last problem is the fear of litigation. Because if we don't go over all the complications, all the possible problems, it can come back to be a problem. And that's actually where this idea of patient presentations came about. There was a patient of mine who had to do a sesamoid removal on this patient. And I usually do this I call it a pre-surgical discussion with my patients, and I have them set it up prior to the surgery. But in this case, I think the surgery was scheduled real quick, and we went over the possible complications, or I thought I'd done the pre-surgical visit with the patient, and we ended up doing it right before the surgery, and it tended to give me quite a bit of stress, as you can imagine. And because of that, that was the first presentation that I ever gave. I called it a pre-surgical presentation. Basically, it goes over what's worked, what hasn't worked, what are some possible options to remove, to avoid surgery, and then kind of what is the plan. I kind of walk them through the whole plan of before surgery, during surgery, and after surgery. And we talk about medications and a lot of these things that we've discussed here in this weekend. That's the first presentation. Then when that started to go really well, I thought, well, how can I multiply that? How can I use that more? That's one technique that for a lot of us in our practice, we figure out, well, what's working and how can we do more of it? And that's where these patient presentations came up. And I thought there had to be a better way, and one of the better ways was this patient presentation. So I want to walk you through, and I want you to imagine this scenario. Let's pick a diagnosis that we all see every single day and has a lot of different treatment options in the office that's quite common. Let's pick plantar fasciitis, for example. So the normal workflow, I don't know about your office, I'll kind of go through in my office how this works, is the patient comes in, they start being seen by the medical assistant, they do the history of present illness, they go through all the review of systems, they ask them all the questions, they bring them to get x-rays, and they bring them back into the room. So by the time I see them, they've had the x-rays, they've had all of the past medical history done, and I kind of come in and they put a little note on the door, said patient with heel pain or plantar fasciitis. And that's when I walk in the door. And so when we walk in the door, we already know the problem. And that's one of the challenges, is that if they say, well, I have pain when I get up in the morning, it gets a little bit better during the day, and then towards the end of the day, it kind of hurts. It's been a number of months. We already know. And our tendency is to rush through that visit, assuming that they know as well. And one of the benefits of using a presentation is it slows you down a little bit and makes you ask some deliberate questions to make you a better doctor. So in my hands, this works the following way. After I've seen Mrs. Jones, I'll evaluate her, push in her heel. I will watch her kind of walk up and down. A lot of times I'll ask Mrs. Jones, can I use your cell phone and turn on the video camera, and I'll have her I'll record her as she walks if I want to show that amount of pronation, because patients like to be involved in their treatment. They like to take pictures. So taking pictures of the x-rays, taking pictures of the of the ultrasounds, of these other things. Patients love that. Or when they walk, you can share and they can see that pronation or the different problems when they're walking. These work really well because patients like to get involved. And then when they come in to sit down, I say, Mrs. Jones, I find it's a little bit easier for me to show pictures to patients because they like to see kind of what's going on. So I'd like to explain a little bit about what your condition is today. Is that okay if I show you a little presentation? And they always say yes. Then what I do is I open up my browser. So I have computers in every treatment room. They have little swivel screens so the patients can see them. And then I go up to the web browser under presentations, and I have all these presentations. They're in alphabetical order. And we're going to pick the one that has plantar fasciitis. And all of these presentations are Google slides. They're not PowerPoints. They're Google. Why do I do Google? Because in each treatment room, I'm logged in under my Google account. And that way I have the same bar up on top of the folder. So basically every treatment room is exactly the same, every computer. So in one tab, I have my medical record, which is Athena. And then in the other tab, I have these presentations. And I'll pick the one that says plantar fasciitis. And now these are gonna look really nice. They didn't start out this nice. I've been doing this probably about 5 years now with these presentations. And they started out really kind of black and white, and they've gotten better. I've paid someone on Fiverr. I don't know if you're familiar with Fiverr. It's a place you can pay $5 and they'll design things. And so I sent them about the 10 or 15 slides, and they made it nice for me. So it didn't start this nice. So I'll say, Mrs. Jones, and I'll kind of go through pretending you're the patient, walking you through it. And it might be of benefit to you to consider using these. We'll go through this. So Mrs. Jones, you have plantar fasciitis. The pain's usually on the bottom of the heel. First, I want to know how it's affecting your life. Are you having pain, frustration? You can't walk, having weight gain? Are you fearful of surgery, missing out on work? You can't be as active? Which one of those fit you? And they usually tell me those. I say, are there any others? Because really, if the condition, no matter what the condition is, whether it's fungal toenails or plantar fasciitis, if they don't have any pain, if they don't have any concern, I don't know why they're in your office. People aren't really that motivated to fix something that doesn't bother them, unless maybe their spouse makes them come in to the office. So I ask, how does that affect your life? Are there any other things that I'm missing? Okay, so it's causing you pain, right? You're gaining some weight, right? And so kind of repeating that back to the patient so they can understand, well, why they're there. And then I say, well, how long have you had your plantar fasciitis? And my rule of thumb is 3 months. I don't know about you, but people that delay, it could be 6 months, could be a year. But for me, I like 3 months, because if it's been a couple of weeks, it's usually under 3 months. And then people that have delayed a long time, it's over 3 months. I find after 3 months, it's a little bit more challenging to treat. I might jump right to some of the more advanced treatments. And then I ask, well, what treatments have you tried? And I have this little checklist down here. These are kind of the traditional treatments that people try. And have you tried any anti-inflammatories? Have you tried any icing, stretching, night splint, taping, supportive shoes, a shoe insert, anything else that you've tried, Mrs. Jones? And they kind of tell me what they've tried. And I can see whether or not they've tried something or whether or not they've just kind of ignored it. And I say, from here, we have a couple of treatment options here. We can ignore it and hope it goes away, which is kind of like what you've done. You can just ignore it and keep doing what you're doing, do those things that we talked about before that aren't working. We could have non-surgical treatment, or we can do surgical treatment. And which one of those you want to do? It's pretty obvious. Most people pick the non-surgical treatment. And what I want to start before we go into anything else, I want to say a lot of times the funny thing is with insurance, they a lot of times they will cover a surgery for something like this. I don't think it's appropriate in your case, and we want to do everything we can to avoid surgery, but sometimes these non-surgical treatments aren't covered, even though they work very well. Insurances just don't cover them. I think you probably find out your insurances are covering less and less. Most insurances, mine are, of course, higher deductible and covering less. but I want to make sure you know all the options. So I'm going to go through all the options and what are the best options for you. Is that okay? And the patients will always say that that's okay. So I like to go over this in the beginning with patients to make sure they know the treatment options and the one that they choose to do. If they want to just ignore it, like other conditions, they can ignore their problem, or they could choose for surgery. I wouldn't do surgery, but they could choose that route. And then I'll go over a little bit about the anatomy and kind of explaining and teaching them what's going on, because we always have to teach our patients, and many times we're in such a hurry. We don't take time with this portion. They don't really understand what's going on. And so I like to explain the importance of the plantar fascia, the importance of the Achilles tendon, how it kind of gets inflamed, how it involves a lot of the muscles in the back of the calf. The back of the calf muscles especially get tight. The posterior tibial, kind of its job. And I'll go in there and I'll explain that. And I'll say, you know, there's a couple of diagnostic exams that are really helpful for me to look at the plantar fascia. We got an x-ray today. And when I show them their x-ray, I actually have a laminated picture of a normal x-ray. So I'll say, you know, let's look at your x-ray and let's look at this x-ray, and we'll point out the differences in the x-ray. That's key. If you just show them their x-ray and they don't see what a normal one looks like, they don't know what to compare it to. And I'll say, well, you have this problem. And, you know, that spur that you see there, the spur usually isn't a problem. So I'll go through that, and I'll say, if I do see other things, I will mention those biomechanical things, and so they can see that, well, there is a problem. And a lot of times it's not just the fascia. A lot of times this could happen from other mechanical problems over time. And then I'll talk about, well, in this other picture here, it kind of looks like black and white TV. This is an ultrasound, and you can see basically the distance between the A lines is bigger on one side than the other. And what that shows is some thickening of the plantar fascia. I actually find that a lot of times ultrasound works better at seeing the fascia. And what I would recommend doing is we're going to start some treatment, but if it's not getting better in a couple of weeks when I see you back, I will do the ultrasound for you. Now that's the way I kind of explain ultrasound. I am the highest ultrasound user in my office. And basically I think by showing the patient, they can see the importance of the ultrasound and they can see the value in it. And I just want to take a little aside because Dr. Bromley, he was talking before about ultrasounds, and I have a whole other presentation. And just so you know, all these presentations, I'd be happy to share them with whoever, and I'll explain how to do that at the end. But I have a whole other kind of explanation of ultrasound images. Why did I do this? Well, once again, I found out with patients, they never understood what they were looking at in the ultrasound, ever. So what you'll see here is these are the most common diagnoses that I'll use the ultrasound for. This is a kind of a checklist, and they're hyperlinked to another slide. And this wouldn't be this visit. This would be the next visit when they come back in for the ultrasound. I'd say, you know, Mrs. Jones, I want to kind of show you what hypoechoic and hyperechoic is. I want to show you, and I use it for all these different things so they can see that. And I say, today we're going to look at your plantar fascia. This is the second visit. And when you look at the ultrasound, everything's going to be upside down. You see how the foot's upside down, and all the pictures are going to be upside down. So you can see here the normal thickness and the thicker fascia. And the normal numbers I put up here on top. So those are the normal numbers, about 4 millimeters. And we're going to measure yours today. We're going to measure both sides. And you can see here that the one side that has inflammation or is painful is thicker than the other side, okay? Or you can just show them the picture. That works really well for explaining it. And then I also say, you know, what you can do is you can take a picture of this with your cell phone so you can see that thickness, or you can show them the area, hypoechoic area of the inflammation at the base. And that's how I use the ultrasound. So I use these presentations because patients never understood what they were seeing, and it increases the value, their comprehension. So let's go back to the regular presentation. So I said, now that we kind of see what's going on, we're going to talk about some treatment options. So the first treatment option here is going to reduce the stress and the strain in the bottom of your foot. Now, you might be wondering how you choose the order. And I struggled with this in the beginning because I was sharing everything with patients, and I was talking to them a lot. And what I realized is the order is really important. Okay. Just like when we're watching a lecture, okay, we get fatigued, we kind of get overwhelmed. There's a lot of information and we want things to be simplified. I don't know about you, but these lectures here have been great because they just kind of simplify. They take a big, 10-page article and they simplify it for us. And that's what we have to do for our patients. We have to kind of give them a high level view and then bring it down to them. And so I say, basically, Mrs. Jones, when we watched you walk before, you pronated in, or when I showed you on the x-ray, you have a collapse in the middle of the foot. And what I like to do for that, and what I think is essential for you, is to use an orthotic to help bring the heel into alignment, or to contour the arch to take some pressure off the heel. And there's a lot of different analogies. I think analogies work really well. You might use the analogy of like getting a concussion, where just the over repeated stress on the head from a football player can cause a concussion over time. It doesn't happen the first time, but it happens over time. And that happens with the plantar fascia. Okay, you can use the example of your foot it becomes mechanically unstable, very similar to how your eyes, you use glasses to help the mechanical instability in your eyes, and you use orthotics to help the mechanical instability in your foot to help, and they only work when you're wearing them, kind of like eyeglasses only work when you're wearing them. So it's important to kind of have an analogy and explain, that's why you need these. Now you'll notice in mine, I don't really go over non-custom orthotics. I don't carry them in the office, and a lot of times and I addressed that before in that previous slide about what they tried before, okay? I'll say, now next, about repairing it and healing it, if your pain level is between a 5 and an 8, a lot of my patients, I use this device called the Shockwave. And I still do cortisone. You're not going to notice cortisone so much in this presentation. I'll show it at the end. But for most of my patients, they choose to do Shockwave now. And so I say if your pain level is a 5 to 8, I would recommend Shockwave. And it's kind of based on a little bullet that goes back and forth, hits and creates these shockwaves, and that creates a healing response in the bottom of your foot, and it works really well. And for the majority of my patients, this is what I use, and they get great results in that. They're done a week apart. I do between 3 and 6 of them. So I'll explain that, and I'll say what you see here. I know a lot of people are scared of the needle, but what you see on the picture on the top is before and after having a amniotic injection in the heel region, because a lot of times there's a lot of focal pressure. I find that when I do the Shockwave, I do it all throughout the heel, and that can help increase the healing. But in conjunction, I use an amniotic fluid in that area. It has a lot of growth hormones to help bring healing right to the area that you need it. Because on the ultrasound, you can see there, Mrs. Jones, that there's an area, that hypoechoic area, and I'm going to inject it right in that area, and that's going to help bring healing. Okay, bring healing directly into that area. It repairs it and heals it. I know you may have had, or if they've had a cortisone in the past, I said cortisone, it might help temporarily, but it doesn't really heal it. It kind of stalls that inflammatory by reducing the inflammation. It stalls that inflammatory process. You can take some anti-inflammatories, but the one thing I want to tell you, if you do decide to do either the Shockwave or that amniotherapy, you can't take any anti-inflammatories around that. And I think they work temporarily. They might be helping in the initial phase, but by now, they're not going to be that helpful. I do find contrast baths really helpful. The traditional icing, I've done that. That's great. Contrast baths you haven't tried, you might want to try it. I like to explain contrast baths as kind of resetting the computer. You kind of do ice water for 5 minutes, then hot water, then ice water. It kind of resets the computer. And then the next phase we need to work on is reducing the tightness. I think tightness is a big culprit. And for many patients, just with the proper working of working out the tightness in the calf, I like to do deep tissue massage more than stretching. Most of my patients get physical therapy. What I'll usually say is you'll probably need physical therapy in the future with a Graston technique because it's all connected, but I think we're going to start with some home therapy. And for home therapy, I usually have them use something called trigger point tools. It's one of these tools. So there's 2 different ways. Do you have any of these at home? I say. And if they don't, I'll say, my assistant, she's going to go over how to use a foam roller. That's the most common one that I use for patients. There are some stretching exercises. I've actually cut this out now of my slides because I don't find stretching all that effective. I like foam rolling more. I think a lot of patients may stretch incorrectly. And then I say, that pain that you're having in the morning, there's a couple ways of helping with that. If you wanted to start, you could start with the stretch, towel stretch, and then putting on a nice supportive sandal. You have to realize, you have to kind of determine what's most important in what visit. So maybe the night splint's not going to be the most important thing in the first visit. It really depends on your style and what you want to emphasize, but I'll kind of come back to this in towards the end. And this slide has really helped me. And I never used to have it and I added it because some patients, they do well with like a velocity brace. Others do well with a cam boot. And I don't do a lot of cam boots or ankle braces. I want to be very clear about that. But for a lot of my patients, they've tried a lot of other things. They only want to do what insurance covers. And I say, well, if you haven't tried a walking boot, why don't you try it? And a lot of them are asking, well, I haven't tried that, or I wanted to try that. And I'll get back to how that happens in a second. And then I'll talk about a nice stable shoe. You see, I'm talking about these stable shoe things kind of towards the end, which isn't the main focus. Okay, just they're tired, they want to get through this. And then I say, we have a lot of advanced treatments like shockwave, amnio, PRP, or platelet-rich plasma. And these are what all the athletes get. And everything we want to do is to kind of try to avoid surgery in your case, right? That's what we want to try to avoid. And then this is a addition that I know it seems kind of a lot of words in it, but I like to simplify treatments with patients. And I say, Mrs. Jones, this is a plantar fasciitis checklist. These are the majority of the time, these are the treatments that I use to make my patients get better. And I have a lot of patients that are in a similar situation with heel pain, very similar to yours. It's really good for patients to know that you have a lot of patients like them. Sometimes they think they're the only one. So it's really good to communicate that to them. So Mrs. Jones, we're very good at doing this. Now, there's a lot of things on here, but I want to kind of, in your specific case, with your specific situation, I think we should do yada, yada, whatever you think that they should do. The reason I like this slide, and even though it's busy, is that if the patient's coming back the 10th time with plantar fasciitis, a lot of times we get stuck. And this checklist helps because the checklist is objective. We're subjectively involved. We're emotional in the situation. But with this checklist, the patients can look at that. And the 10th time they've come back, they can say, well, we've done the x-ray. Yes. We've done the ultrasound. Yes. MRI. We haven't done that yet. It's the 10th time. We've done a lot of things, cortisones, amnio, PRP, you have orthotics, you're still not better. Let's get an MRI. Okay. Or if we go down here, the way I kind of delineate the treatments, and you can do it however you'd like, but I put in, what are the traditional treatments, what are to repair and to heal. I talk about that. That's what most of my patients want these days, is they want to regenerate and heal the tissue. That's regenerative medicine. And what works best in my hands and for my patients is a combination of shockwave with amnio. Okay. The way that works, Mrs. Jones, is we do between 3 and 6 shockwaves. At the second session is usually when we do the amnio. Okay. And then we'll go down to reducing pain. I don't do that much cortisone either. Anti-inflammatory, not much. Icing, contrast, yeah. Physical therapy I do, home therapy and the night splints I do. Reducing stressing and the strain, that's where we talk about the orthotics to help give you the additional support and to reduce the pressure and that concussion. You bring them back to the analogy. That's all I really remember. If you have that constant concussion on there, and then that'll kind of reduce that constant impact. So I think in your case, let's say the first visit, they're here. I say, in your case, Mrs. Jones, it's going to be best to do the shockwave and the amnio, and then custom orthotics. How does that sound? Okay. How does that sound? Patient communication is really the key. What I used to do is, as I say, and I used to kind of give them all these options, say, well, what do you want to do? And that's not what patients want. Patients need you to guide them as the doctor, what you think is best and what will get them better and what your experience has gotten them better. So if in your hands it's cortisone, you're going to talk about cortisone, whatever it is. But by the 5th or 6th visit, if they're not getting better, it's good to have this as an option. Okay. And then we can talk if you have other questions about how to talk about the payment of these things, because some of these things aren't covered by insurance, right? So we have to make different. We can talk about how to communicate that if you'd like afterwards. Okay. And then I say, Mrs. Jones, a lot of people like these presentations, and if you want to, you can download this. And anyone that's here that you're watching this video, you just click it, and you'll be able to take into my actual presentation that the patients can look at if they want to remember what we talked about. So sometimes it's overwhelming, and I say, this is going to be a lot of information, but this is a resource for you. Patients can or can't do that. They like to be involved. Then the next step is when I'm kind of doing the note and we've kind of decided what our plan of action is, I will go to something that's connected to my medical record. I use Athena, and there's a place where I can connect to third-party vendors. So it actually pulls in their email and their name into this thing called Patient Education Genius. If you haven't heard of it, it's great technology. And I have, you can see the folders on the side where I have everything in alphabetical order, and then I have content. And basically this content is what I'll click on. It'll email, it'll either email or text it to the patient. Most patients just want texts. I can text it to them, and I'll give them the shockwave information, foam rolling, a video I made on foam rolling, a video on how to treat plantar fasciitis, a booklet I did on plantar fasciitis, and more information about shockwave. And there's other things you can add as much stuff as you want in here, and it's pretty reasonable because we used to print out a lot of information, but now we do a lot of videos and PDFs, and certainly you can ask them, and I'd be happy to give you my content if you want if you want a Patient Education Genius account. And then they get this message here, and this message comes via text or email, and it says you have 2 health education materials, and they click on it and they can view those. And the neat thing for Patient Education Genius, if you haven't heard of it, is that they have a chat bot, and it has a little chat bot thing that says, "Thank you for being at Central Mass Podiatry. Your feedback is important. Did you have a good experience?" If they say yes, it will ask them to go to Google reviews and get a review. That's how we get like hundreds, and yeah, I think we're up to maybe 700 reviews that way, or 1,000 reviews, something like that. Because every patient gets this, and every patient goes online. Sometimes the thing is, if you depend on you remembering to do this, you're not going to do it. So it has to be automated. And so this is a great method of you're sharing patient education information, but you're also boosting your online reviews. Okay. So that's kind of the whole gist of the presentation. And I wanted to talk kind of what are the benefits. In my hands, what's worked is, first, it's a wow factor. With patients, they'll say, doc, no one's really ever been that prepared for my condition to explain it to me. And many times they become wowed just because of that, because no one has really taken the time to prepare, to explain. And it doesn't take that much preparation to do these things. Also, it reduces your liability, because when you do the presentation, I put it in my notes that I did this presentation, explained everything. Also, when I send the patient education information, that actually documents in my chart that I gave them that patient education information. And I'm being more comprehensive, okay? Especially for like a bunion or something else. You talk about let's say it's a pre-surgical visit, so you're talking about the possible complications. I actually show them pictures. I talk about dehiscence. I talk about everything. I try to scare them during the presentation I want to go over so they're aware. Another benefit is it slows you and focuses your patient visit. Okay, what I find is that we're always in a rush. We're 2 patients behind. We're always in a go. And so what happens is, if you have 5 minutes, you give them the 5-minute spiel for plantar fasciitis. And if you have 10 minutes, you give them the 10-minute version. If you have 20 minutes, you give them the 20-minute version. So I find it really slows me down. It makes me more deliberate, and I focus on the patient. I'm not basing it on how much time I have or what I think of the patient. I really offer everything to everyone. And they always talk about that when you're talking about treating. You don't judge the patients and what you think they can afford or what you think they can do. It's kind of cool as well. You can show this anywhere, even on telehealth. So as we're doing Zoom visits for our patients, I could bring up this presentation and actually show it to them, or I could email it to them and they can pull up on the screen, and I can kind of go over and educate them that way. It kind of increases referrals and online recommendations, as I talked about for the other thing. And it's more comprehensive. This is the neat thing. So if you come to the conference and you want to try something new, a new product, or you want to put something into your patient treatment process, you can just add a slide for it. And that's the neat thing. You can add things, you can delete things, you can offer things. And for me, it's been a real great boost with, for example, diagnostic ultrasound. It just went part into my thing. I'll say, I'll do this the next visit. What do you say? Because for me in Massachusetts, it's not covered. So I say it's $100. We'll set that up the next visit. How does that sound? Okay. Walking boots as well. When I pull up that last slide, a lot of patients say, well, I tried that, I've done the MRI. I haven't tried the walking boot. I haven't tried the ankle brace. For PadNet or circulatory studies as well, I have a kind of a similar thing, or for shockwave or PRP or amnio, it makes it a lot easier showing pictures and explaining the same way that the ultrasound helps you to explain things 10,000 times better. These presentations really, really help. And then referrals, patients are kind of amazed at this. So I get some common questions with these presentations when I explain this to the residents or to others that are visiting. Do I have time? Really, the time it takes to make them takes a little bit extra time, but the amount of comprehensiveness you do with these is pretty amazing. It doesn't take that long to do them. You kind of get into the flow, and if you have it, you can have it easily accessible. It doesn't take much time. I would pick one presentation to start with. The one I did was my pre-surgical discussion, and I went over that, and I did it over and over and over again, and I got really good at it. And I keep on tweaking it every time there's an error or there's a new question. So I base these on questions. So when patients ask me a new question, I'll change the presentation. What if I don't have a computer in each room? Well, there's a couple of options. You can print them out. You can use like an iPad. There's a lot of other options to show them. And if you don't know how to make them, we're going to go over a few things technically on how to make these. That'll be the next step. And we'll answer other questions at the end. To make the presentation, there's a little form that I made that just makes it easier to do this. And you can download it. I'll give you the link. You can download it with this thing if you use your phone to link to it right now. But basically, when you make a presentation, this is kind of the outline that I used. I look at the diagnosis, like pick one diagnosis. What's actually working today in your treatment? What's working really well for you? What's not working or what's causing frustration. Like one of my frustrations was I wasn't doing that much ultrasound, or I wasn't doing that many orthotics. And some of the improvement ideas where I put a slide about ultrasound and I had a description of ultrasound to show the patient the value of it. And for orthotics, I moved it higher up in the presentation process. How do I best explain the condition? I think we talked about in this condition using the eyeglasses or the concussion or whatever you want to use. What diagnostic exams do you use? What treatments do you use? What do you do for in-office dispensing? And what do you do for durable medical equipment? One thing you have to remember is you only have so much time with patients. In the beginning, I used to spend like 20 minutes trying to offer someone a pad that was like $5. And you really have to realize that you have to focus on what will bring you what will help the patient the best, and then what's good for value for your practice. Okay, so you can't be focusing on all these little things. I tend to focus on the larger ticket items. It takes practice to do that. And what can I do to add value to the patient's experience? And that's something that's really key. That a lot of times we don't think about that. So what are things that you can do? For example, my post-op patients, I think many of you do as well. I call them after that. If there are certain procedures I want to encourage, for example, I'm doing more Cariflex now, or these Onifix or Amnio, I'll actually call them afterwards as well. Those are like kind of value adds that I do, and I have a little system I can explain that to you if you'd like how I do that. I call them the night of, and I get the phone number so I can call them easier. And what's the takeaway patients can leave with? And that's a key as well. Patients, it might be virtual, like the PDF or the video or something else, but what can they leave with? And then any improvement ideas. I think it's always good to do this maybe on an annual basis for the more common diagnoses that you do. And then how can you improve it? I think we shouldn't be changing and staying the same. We should always be kind of improving the way we do it. If you come to a seminar, you learn a better way of treating ulcers or a better way, and you could improve that and include that. And then I have the whole process kind of down there, how you make an explanation slide, diagnostic exams, treatment categories. So you can do these your own, or you can use some of mine to start as a template. I'd be happy to share those with you, okay? And here are kind of the answers for this, which I talked about. I wanted to improve, do more ultrasound. That improvement idea of the checklist came off from this, the anatomy, different types of things like that, okay? So we're going to start with part 2 here. We're talking kind of ways now of building. What I find, and what you may want to consider, are things that are working for you. You want to kind of multiply, right? You don't want to take something that's really working well and just stop doing it. That's a lot of times what we do. If something's working really well, we stop. But what's better, I think, is that if you take something that's really working and you multiply it. So let's say you love these presentations. You get one presentation that you really like, that you're getting really good at, like plantar fasciitis. Okay, it's helping you multiply it to other presentations. But another way is to kind of go deeper. And that's the way I want to explain some ways you can be creative. So you can use these same presentations, use Zoom. Okay, everyone has Zoom now. You turn on Zoom. Okay, you turn on your Google Slides full screen, and you hit record, and then it will record. I think a free Zoom account has 40 minutes. You shouldn't talk more than 40 minutes. But then you can take these videos and you can put them on YouTube. So the same explanation that you just gave to the patient, you can say, you know, Mrs. Jones, we went over a lot of information today. For you to review, I did make a video and I'm going to send this to you afterwards so that you can review it, or you can put it on your website or under your plantar fasciitis section. Okay, you can use it for videos. You can put it on your Facebook, on your LinkedIn, on anything else that you'd like. Here's an example of my face here. Another neat one, everyone's used to webinars now, and our patients are used to webinars, and we wouldn't all of us love to be in front of our patients, but we can't. Like, we can't do any seminars, we can't get in front of them. So how about combining Zoom with Calendly? And what I mean by that is Zoom, you could just do a Zoom. You take your presentation that you just wrote, and you say, you know, everyone come to Zoom at this time. That works pretty well, and you could send it to your patients. But if you add on top of that, there's an app called Calendly, and what Calendly is an app that you can make events for up to 100 people. You can do probably a different account. Actually, mine's only 100 because my Zoom account's 100. I could do a lot more if I had a Zoom account that had more people. And then basically what it does is when people sign up for it, it sends them the Zoom link. It sends them a reminder the day of, and it sends them a thank you the day after. So what I tend to do is I'll send them the reminder the day of. They'll come. So I did one recently. I'll tell you about it here. I talked about new treatments for ingrown or ugly toenails, and we talked about Onifix and Cariflex. Okay, these are 2 treatments for toenails. And I did this for, I think it was a group of 40, I had 40 or 50 sign up, and I had like 23 that came to it of my patients. And it was fun. I did it on a Saturday afternoon, took a half hour. And then afterwards, the day after, I actually took that presentation, recorded it, and then when it sent them the thank you, because it sent it to everyone, even those that didn't come, and then it sent them that video as well and the slides. I posted it on my blog. Anyway, I can explain more if you'd like. But that's kind of a neat way of using these presentations as well, other presentations that you want to make. You can also take them and email them in a newsletter. So we sent it out here. If you're scheduled for foot surgery, he's going to talk about different aspects of bunion surgery. Here's the video, and that's a video. I use the same slides, and I recorded a video. You can use the same video on social media. Okay, probably not the slides as much, but maybe the video that you made. And here's another video. You can use it on your blog. So you can either put the slides themselves in the blog, or you can use it for the blog. Here's my blog. And then finally, if you kind of want to get creative, what you do is you take these slides and you use them as the pictures in a book. Okay, real easy way to do this is you do your lecture, you record it, you send it to someone on Fiverr, they will transcribe it and have them take that, and you can edit it and make it into like a book format. Okay, for those of you that are perfectionists, you can also just type out the book and write the book and use those pictures that you like. Okay, so it's kind of a more advanced way of doing this. Okay, so there's a couple of books that I did that way. Okay, and then I give them, when the patient comes in, I say, yeah, I'm going to send you a link to this book. Okay, I hope you found this helpful. How do you get started? Well, once again, if you liked this presentation, you can download it right here. There's a QR code. Just download it. You get all the slides here of the plantar fasciitis. If you want, also, you can get the same ones on my blog. It's drpelto.com. There's something that says patient presentations. And then if you have any questions or comments or thoughts, or if you're interested in doing it, or you get stuck, or you can't get through some things, email me. I'd be happy to call and chat with you. This is kind of a passion of mine. Here's some articles that talk about effective communication and teaching skills as a doctor. And here's some articles about that, about health coaching and things like that. So I think this has been a kind of a practice changer, makes much more efficient And so I thought you would enjoy it here at the conference. Thank you.